Opioid pain medications can change lives. They can also change how your nervous system works. For many chronic pain patients, the same pain medications that once brought them back to life stop working over time. They can even start making their pain worse. And too often, patients get blamed for what's really just biology. Understanding how opioids affect the nervous system isn't just science. It's justice for the people who are wrongfully blamed for having a normal biological reaction. The neuroscience helps explain what's actually happening, how tolerance, dependence, and even pain sensitivity develop through normal biological adaptation. When you understand that, it becomes obvious. Patients aren't the problem. They didn't choose this response. Their nervous system simply did what human biology does best: adapt. To understand how opioids help pain, you have to understand what pain really is. Pain doesn't come from your back or your knee. It's a response created by your nervous system when it decides something might be dangerous. It's a protective system, and it tends to become overprotective at times, just like a parent who is worried about their kids. Opioids work by turning down that protection system. They attach to specific receptors in your brain and spinal cord. When those receptors are activated, the nerves that normally pass danger messages upward toward the brain become quieter, and at the same time, your brain's own calming systems send stronger signals back down to dampen the response. The result is a quieter system. The nervous system feels calmer and safer, and in turn, you feel less pain. That's why for short-term or unbearable severe pain after an injury or with cancer, opioids can be very useful. They change how the nervous system filters and reacts to potential danger. But they don't fix the reason the alarm was triggered. They just mute it for a while. And when that alarm stays muted for too long, the nervous system starts to adapt. Those very changes in the nervous system can start to act against you if they keep changing over a long period of time. Now, this next part is important because it's where so many people with chronic pain have been misunderstood and mislabeled. When you've been on opioids for a while, your body and brain start to adjust. And that adjustment can show up in a few different ways, and the medical system often mixes them up. There's a big difference between tolerance, dependence, and addiction. Tolerance means your body gets used to the medicine. The same dose doesn't calm things down the way it used to, because your nervous system has adapted to expect it. Sometimes that means you need a bit more to get the same level of relief. That's tolerance. It's not addiction. It's normal biology. Dependence means your body now relies on the medicine just to stay normal. If you suddenly stop or lower the dose too fast, your system reacts with withdrawal symptoms. That's anxiety, sweating, muscle aches, and nausea. That's not a craving for drugs. That's your nervous system trying to adjust to a quick change in chemistry without the medication it had for such a long time. Addiction is different. Addiction isn't about the body adjusting. It's about behavior. It's when the brain's motivation and reward systems start driving compulsive use and loss of control. Addiction is using the drug despite harm. Dependence and tolerance are expected. Addiction is not. Most people living with chronic pain develop dependence and tolerance, not addiction. Their bodies have adapted, but their intentions are to function, to get through the day and to live their lives, not to chase a high. Research estimates only about 7 to 12% of chronic pain patients develop what meets the clinical definition of addiction. Unfortunately, the medical system often fails to make that distinction, and that failure has had real human costs. People who were stable, functional, and doing everything right suddenly found themselves treated like criminals. Their prescriptions were stopped overnight as pharmacies refused to fill them. Some were forced into withdrawal, not because they did anything wrong, but because the system panicked. I know because I've treated these patients. I've heard their stories. They constantly felt like they had to prove that they were in pain in order to be treated like a patient and not an addict. They constantly felt like they were guilty until proven innocent. These patients weren't chasing a high, they were chasing normal. They were trying to get back to work, to care for their families, and to sleep through the night. And that confusion, mixing up dependence with addiction, has caused enormous harm. It's broken trust between patients and clinicians, driven some people into dangerous withdrawal, and left others too scared to ask for help. Dependence is not a physical weakness. It's a predictable, measurable biological process. Knowing the difference matters, because when we mix them up, patients suffer from the system's misunderstanding. In the next section, we'll look at one more kind of adaptation, when the nervous system itself becomes too reactive and the medication that once calmed pain starts to make it louder. Have you ever felt worse pain while taking your pain medications just like your doctor told you to? or even after they increase the dose? It doesn't really make sense, but for some people, the same medication that can help make their pain better can also slowly start making their pain worse. It's something called opioid-induced hyperalgesia, and most patients are never told it even exists. Imagine your pain system as a smoke alarm going off when you're in a fire. When you know there's a fire already, you don't need the alarm anymore. Opioids help by lowering the volume of that alarm so you can think and figure your way out of that fire and function. But if that alarm in your nervous system stays quiet for too long, the brain starts turning up the sensitivity to make sure it can still detect danger. Your brain almost gets a sense that it's too quiet and assumes something is wrong when it's not. Over time, the alarm starts going off more easily, not just for fire, but for burnt toast. That's what opioid-induced hyperalgesia feels like. Pain starts spreading to new areas, or it burns and aches in ways that you can't explain. You haven't injured anything new, but your system is reacting as if you have. And the confusing part is that taking more opioids often makes your pain worse, not better. We know this from both animal and human studies. Nerve cells that used to keep your alarm system from going off too easily start acting like police that keep the system on high alert. And other nerve cells that act like a microphone for danger signals in your body start acting like a megaphone for those same signals. The combined effect is an amplified pain system that makes it easier to feel pain and makes your pain worse. This doesn't happen to everyone, but it's real. And when doctors don't recognize it, they often keep increasing the dose, thinking that you're just building a tolerance to the pain meds, but that's exactly what's making you feel worse. What everyone should learn, though, is that the sensitivity can reverse. When doses are slowly reduced or rotated to different medicines or paired with treatments that can help calm the nervous system down, pain can calm down too. So if you've ever noticed your pain growing or spreading even while on the same or higher dose of opioid pain medications, it doesn't mean your pain is all in your head. It means your nervous system might be going through opioid-induced hyperalgesia. I hope all of this helped shed a little more light on how difficult it is to be in chronic pain. The goal shouldn't be to just cut off all opioids right away and deal with the consequences. The goal should be to figure out a way to help your nervous system find balance again. And it's important to remember, doctors are not the enemy here. Everyone is just doing what they truly believe is right. They're doing the best they can with the research and data available. They want to help the best way they can. This isn't about blame. It's about learning, healing, and getting your life back to the way you want it.